Ichthyosis is derived from the Greek word ichthus, which means fish. It presents itself as a fish scale-like skin. It affects all different ethnicities, genders, and age groups. A skin disease that we all fear.
Ichthyosis refers to a group of skin disorders that causes persistently dry and scaly skin all over the body. One type of this is Harlequin ichthyosis, sometimes called Harlequin baby syndrome or congenital ichthyosis. This is one of the severe form of ichthyosis that presents at birth as a hard, thickened, armored-like plate of skin covering the entire body. This is also considered as one of the rarest skin conditions in the world. The skin of a newborn with Harlequin ichthyosis is covered with thick diamond-shaped plates that resemble fish scales. These plates makes it hard to breathe and eat. This is why newborns with Harlequin ichthyosis need immediate intensive care. The symptoms of Harlequin ichthyosis change with age and tend to be more severe in infants. In newborns, babies with Harlequin ichthyosis are usually born prematurely. That means they have a higher risk of other complications as well. The sign people usually first notice is hard, thick scales all over the body, including the face. The skin is pulled tightly, causing the scales to crack and split open. This hardened skin can cause a number of serious issues, including eyelids turning inside out, eyes not closing, lips pulled tight, leaving the mouth open and making nursing difficult, ears fused to the head, small swollen hands and feet, limited mobility in arms and legs, nursing difficulties, breathing problems due to tight chest skin, infections in deep skin cracks, dehydration, low body temperature, and high sodium in the blood known as hypernatremia.
So, age of onset ang tawag sa most common ages kung kailan nakukuha ang symptoms ng isang disease. So, cancer ay isang example ng multiple age range dahil pwede natin siyang makuha in different parts of our lives. For example, pwede natin siyang makuha in our adolescent period, pwede rin natin siyang makuha in adult period. So, another example is our topic, which is Harlequin ichthyosis. So, yung Harlequin ichthyosis ay nakukuha in a single age range, meaning nag-uumpisa lang siya sa kapanganakan up until 4 weeks after birth. So, age of onset, nag-iiba-iba siya depende rin sa diseases, and ginagamit ito ng mga doktor para ma-determine yung mga diagnosis. Yung Harlequin ichthyosis ay caused by the mutation of ABCA12 gene. Yung ABCA12 gene ay ang gene codes for protein necessary for transporting lipids out of the cells in the outermost layer of skin. And yung Harlequin ichthyosis ay nai-inherit in an autosomal recessive pattern. So, yung autosomal recessive pattern is one of several ways that a trait, disorder, or disease can be passed down through families. As you can see, the parents are both carriers of a genetic disorder. The firstborn is considered the unaffected one because he inherited the unaffected genes of both parents. On the other hand, the two middle children inherited the unaffected and the unaffected genes of both parents, which makes them the carriers of the genetic disorder. While the last born became the affected one because she inherited the genetic disorder the carrier parents had. Most of these gene variants ay nagre-result sa pagkakaroon ng abnormally short protein na unfortunately ay hindi nakakapag-transport ng lipids properly. Yung mga tao na may ABCA12 gene variants na nagre-resulta ng kawalan ng ABCA12 protein completely ay may chance na makakuha ng mga most severe cases of skin problems, and kadalasan ding hindi nakaka-survive after infancy. So, as a summarization, to make it short, ang Harlequin ichthyosis ay kadalasang nag-uumpisa mula kapanganakan hanggang 4 months after birth. And dahilan nito ng mutation o mga variants ng ABCA12 gene. Ang Harlequin ichthyosis ay namamana dahil may autosomal recessive itong pattern and hindi tukoy yung recovery time ng mga individuals na mayroon nito. Dahil it depends pa rin sa stage ng condition kung gaano kalala yung Harlequin ichthyosis.
Unfortunately, up until now, there's still no cure for Harlequin ichthyosis. That's why skin management becomes a crucial part of the equation after initial treatment. A newborn with Harlequin ichthyosis requires neonatal intensive care, which may include spending time in a heated incubator with high humidity. They are to be monitored in temperature, respiratory rate, heart rate, and oxygen saturation. Other treatments also include the application of retinoids and topical antibiotics to help shed hard and scaly skin to prevent infection. As for the medication, enhanced survival and decreased morbidity is reported with the use of systemic retinoids. And retinoids, these are a class of compounds that derive from vitamin A, and they bind to specific retinoic acid receptors and regulate gene transcription. They influence keratinocyte differentiation, normalize abnormal keratinocyte proliferation, and mediate desquamation of hyperkeratotic skin. Researchers also recommend frequent application of emollients or moisturizing agents to ease the shedding of thick plates when retinoids are given. And one example of a retinoid is erythrinate, and it was first used for the treatment of this disorder in 1985. And an effective dose of 1 mg per kilogram per day was established. But this drug is no longer available and has been replaced by other retinoids with improved safety profiles. An example of safer retinoid is acetretin, with a commercial example of soriatane. And it is a carboxylic acid derivative of erythrinate and is the retinoid most commonly prescribed in neonates with Harlequin ichthyosis. An initial dosage of 0.5 mg per kilogram per day are recommended. Improvement in hyperkeratosis is reported with the use of this. However, the duration of the therapy is varying, meaning continuous, long-term, and daily therapy may be required. The daily dose can be titrated to the degree of ichthyosis. For infants, an example, the oral acetretin can be dissolved. These are 10 mg capsules in Ura Plus solution for precise weight-based dosing. Another example of a retinoid is isotretinoin, with commercial products such as Amnesteem, Claravis, and Sotret. These have also been used in Harlequin ichthyosis, and the reported dose is 0.5 mg per kilogram per day. And treatment is usually initiated within the first few days of life and is given orally. Case reports have documented improvement in pliability of the skin, limb movements, sucking, and eyelids closing within a week of starting therapy. And that's why this treatment has been continued for several years in some patients.
As mentioned before, there is no cure for Harlequin ichthyosis yet. So the treatment or management for this genetic skin disorder is centered around protecting the skin and preventing infection. So for people with Harlequin ichthyosis, it is crucial for them to apply ointments and moisturizers right after a bath or shower so that the skin is still moist. This should be done in order for maximized benefit. Keeping your skin clean, moist, and supple is so important for children and adults in order to prevent dry and tight skin. Kasi kapag yung skin nagkaroon ng crack dahil sa sobrang dryness and hindi nga na moisturize, yung crack na yun, yung parang pwede maging vulnerable to infection. So, softening emollients, especially those containing urea, salicylic acid, or alpha-hydroxy acids, are particularly effective when applied after bathing. Yun nga, since mentioned before, while the skin is still moist, these products help to keep the skin moisturized and pliable while preventing the skin from cracking and fissuring, which can lead to secondary bacterial infection. So, dermatologists may also recommend products which contains moisturizers such as ceramides, cholesterol, lanolin, and petrolatum. Ceramides are essentially the glue that holds our skin cells together to keep our skin barrier intact and healthy. About cholesterol, when cholesterol is applied to skin topically, it plays a replenishing role to support the moisture balance and lipid composition for healthier looking and feeling skin. Lanolin naman, its emollient conditioning properties make it an effective ingredient in combating dry hair and dry skin. Petrolatum, it has the ability to penetrate all of the uppermost layers of the skin to fill in the spaces between skin cells. So for people with Harlequin ichthyosis, their skin demands a meticulous skincare regimen. Some people in the ichthyosis community recommend lactin, which contains the AHA lactic acid, and others recommend adding a few ounces of glycerin to any lotion to help the skin become moist for longer periods of time. You can find pure glycerin in some pharmacies and online. For alternatives naman, vitamin D intake should also be considered in order to avoid the retinoid side effect and investigate further the possibility for a better outcome.
Ichthyosis is something that is very visible. So whatever they are struggling with, people can physically see that, but not everybody can notice how they also struggle psychologically. So we need to understand that it's okay to be different. In our image-driven world, there are a lot of people struggling out there. Remember, it doesn't take much to be compassionate, and it doesn't cost much to be kind. Know that a simple act can make a huge difference.